Good evening.
Yeah, welcome to Rockwoods webinar series. All the parents, students, and teachers are waiting for your talk. We would like to learn many things from sleep. In fact, for the last couple of weeks, we have been discussing about food and our health, and also our behavior patterns and character. Today, we would like to learn about sleep, so that this third series, the last one, we would like to talk about meditation. So once someone is really good at their behavior patterns, their food and their sleep, the fourth one is meditation. Maybe a person can have the complete understanding of human behavior and biological body, and also he can perform best in his life. That's the reason today we would like to seek your help to understand sleep patterns and also try to learn from you.
Definitely.
Ma'am, could you please introduce Sandeep when he was here for a couple of minutes?
Yes, sir. Yes. So we have here with us Dr. Sandeep Bharma, and he is a consultant pulmonologist at Care Hospital, and he has done his post graduation in pulmonology from the Christian Medical College in Chennai, and he has also done his sleep study from Johns Hopkins University, USA. And we are eagerly waiting for you to throw more light on the most essential component for us, and that is sleep. Over to you, Dr. Sandeep.
Yeah, thank you very much for the kind words. And it's always pleasure to interact with teachers and obviously parents. And this very important topic. Do you would like me to share my screens right now?
Yes.
Yeah.
Yes.
So absolutely right. Sleep is quite very important in everyday life, and especially more so in children. Good evening, everyone. I'm Dr. Sandeep. I'll be taking your very basics of sleep and especially tips how parents especially can help their children for the ideal sleep and all. Okay. So when we talk about sleep, sleep is kind of a reversible state of reduced responsiveness, motor activity, and metabolism. And you'll be surprised that we spend almost 1/3 of our life in sleep itself. So we are calculating about 8 hours per day, per night. So it helps us restoration and in restoration, energy conservation, and memory consolidation. So sleep is very important. And not only for restoration and other things, but it is very important for the mental and physical health of the child. And if you're finding that your child is it's not having enough sleep, you are not alone. Actually, what they say is almost 25 to 50% of the children have sleeping problems, one thing or the other. So to understand the sleep, we need to understand the sleep patterns better, and then probably we can help your child in providing better sleep. So why sleep is important in children? So research has shown that it is direct effect on the happiness index, impact of alertness and attention, cognitive performance, mood, vocabulary acquisition, learning and memory. In fact, in infancy, it affects on growth too. And in toddlers, memory consolidation and motor skill development. So obviously it's very, very important that your child has enough sleep and a good sleep. So what happens when the child doesn't get enough sleep? So as every parent might be knowing that if your child is not having good sleep, he becomes grumpy and hyperactive. So you can understand how sleep is important. So sleepiness can affect your child's ability to pay attention in school and have ramifications in their school performance too. And not only school performance, growth and everything, but poor sleep actually is linked to allergic rhinitis, a form of an allergy, problems with immune system, anxiety and depression in later part of their life. And it is emerging evidence also is there that poor sleep in childhood is linked to obesity, diabetes, and high blood pressures. So not only academic performances, but also linked to long-term health issues too. So sleep is quite important for your children. So there are a lot of sleep problems when we talk about then even the minor things like, new siblings coming into the family, teething, an illness, a different place, a new caregiver, a change in schedule, a minor complaints. These kind of things can also affect them during sleep, and that should be taken care of. And the very common things are allergies, cold, and ear infection too. So you have to listen to them, take care of them. And apart from the smaller things, there are major issues in sleep disorders, like we generally see night terrors or nightmares in children, sleep apnea, sleep talking, sleepwalking. Some children do snore, and there is a thing called Restless syndrome. I won't go into the detail of every aspect because that itself is a big thing, but I'll just touch up everything and then go in the tips how to get a good sleep. So night terrors and nightmares, both are different. Children often wake up in the night and usually they fall asleep again and they don't remember anything. You just have to reassure them, and you don't have to worry about it. And it's very, very common, and it's usually seen in 25% of the children. So night terrors and nightmares are very common. So you just have to reassure them. Sleep talking and sleepwalking. Again, sleep talking, we have seen so many children sleep talk. It's totally harmless unless until it's disturbing other children. But again, you don't have to worry about it. You just have to reassure them. And sleepwalking, again, sleepwalking actually is quite common than we know. It almost occurs in 1 in 3 children before the age of 13. And if your child sleepwalks, you need to have a good idea when he sleepwalks, because there's a very specific times when it does in the sleep. So you need to have put a safety proof their bedrooms and install alarms probably. And a very good idea, a tip apart from medications, are like waking up before half an hour before he actually sleepwalks. So that will stop the sleepwalking itself, a habit itself. The other thing is a snoring. Snoring, everybody snores. It's not a problem. Even children snores occasionally. And it usually occurs because of the swollen tonsils, adenoids, some allergies, obesity, secondhand smoke, especially the family, somebody smokes, that also affects the snoring problem. So you don't have to worry about it unless and until your child shows the daytime sleepiness, not able to concentrate on the studies and have daytime nappings. So in these kind of things, probably the child might be having a thing called obstructive sleep apnea, and you need a doctor's consultation for that to evaluate that. Other thing, a very common thing is restless syndrome. It's basically irrepressible urge to move the legs, and it is very difficult to identify when children, but again, a lot of adults might know about it. And if your child moves their legs or hands in the night and it disturbs their sleep, then probably some of the tips which comes in the later part of the presentation will help you. Apart from that, there's no as such medications as such for children. So when we talk about sleep, a lot of people, a lot of parents grumble that my child sleeps a lot, and you should be knowing that a newborn, obviously, sleep is very important for them, and they just get up only to for the feeding part of it. As you grow older, sleep timings actually comes down, and need 10 at least to 12 hours of sleep. And if you don't sleep that much time, probably you'll have problems. School age children, that is 6 to 13 years, need at least about 10 hours of sleep. And when you're talking about teenagers, they need at least, regarding adults, if the parents are curious, at least 7 to 9 hours. Average is 8 hours. If you're less than that, probably you're sleep deprived, and you need to think of your sleep. And what can you do if your child doesn't sleep enough? Obviously, about 25 to 50% of the young children have this problem. The parents have to create a routine for themselves, and they should help the children imitate themselves. Usually in the teenagers and the toddlers, they usually imitate their parents. So you need to start from the home, from the parents itself. And there are a lot of things what you can do for your bed environment. It has to be peaceful, quiet, comfortable, appropriate mattress for the height of the child. If it is, they shouldn't be crumbled up in the bed, and minimizing distraction, especially TV. Should usually they say that TVs and other things, electronic devices, shouldn't be in the bedroom of the child. So sleep strategies for the kids. So the behavioral changes and adjustment of the sleep environment will help most children. And the list might look long, but again, this is very important, and you might know few of them also. So the main thing is sleep hygiene, what we recommend for the children as well as for the adults. So you need to make a habit of everything, you know. So even the sleep hygiene basically deals with that, and it's a collection of habits. And the habits can be anything, and not more, but at least 3 to 4 habits before you go to sleep. You make it as a routine, and practicing daily, and consistency is the key. If you practice daily, probably you might able to achieve that. And what is a sleep hygiene actually is basically to create a routine. It can be anything. So before you want to go to bed, which you should at least decide 20 minutes before you want to do it. Some people do soothing activities like wearing a pajamas, taking a warm bath, or brushing your teeth, or reading, or some people do listen to music at that time, and that creates a routine so that, you know, child will understand, okay, this is our time to sleep. So you need to create that kind of an environment in the house, or in the routine of the child. At least it should start 20 minutes, and one by one the routine should be continued. And so that at the end of 20 minutes, or at the end of half an hour, the child actually goes to sleep, and that becomes a routine for them. So you need to set a bedtime. It's very important. Unscheduled timings to get going to bed is as a big problem. So schedule a bedtime, whatever time you want to go to sleep. 10:30, 9:30, 9 o'clock, doesn't matter. You need to set a bedtime, and you need to do it every single day and stick to the bedtime. And you need to, the most important thing is, usually parents or any teenagers, they think that the child is too rested, so they make their child sleep more in the weekends, like in the Sundays and all. That shouldn't be doing it. So that again, it disturbs the week activity. So it needs to be consistent even on Sundays or holidays also, so that becomes a routine for them. And the most important, and I think everybody is worried about that, is the screen time. TVs, be it tablets or any devices, mobile devices. The problem with the devices, TVs or tablets or mobile devices, it emits a blue light. And the problem with that is like it has a certain wavelength which actually affects the brain. And the brain specifically a hormone called melatonin. And the melatonin is kind of a sleep inducing hormone. Let's say the melatonin is not secreted, then you won't fall asleep at all. So obviously you need to implement a strict curfew of the screen time, be whatever it is, TV, tablets, mobile devices. Any form of blue emitting light should be is a problem. In fact, not only that, bright lights like LED lights, which we usually install in our bedrooms and all, are also a big no for them. So get exercises. Obviously, obesity has a problem with sleep. So get an exercises. What usually says in children, at least 1 hour exercise, 1 hour is more than sufficient. And if you can't do that in the later part of the day, like after 5 or 6 o'clock, make it as a routine that you do it in the early part of the day, so that it doesn't hamper your sleep. So, but make a routine activity that you get at least 1 hour of an exercise. Avoid the scary content. Now again, with all the devices what we have, you don't know what kind of content you're seeing. And if your kiddo likes any gory stuff or spooky stuff, stories and everything, so save it for the daytime, not in the nighttime, because they might have disturbed sleep. So you don't have to do that in the night, especially in the later part of the night. Caffeine, you might be surprised that a lot of people do take caffeine in a lot of forms. Not only coffee or tea, but even sodas or energy drinks have a lot of caffeine. And you need to actually take care of that. And you'll be surprised that even chocolate has it. So even later part of the day, if you take it, you will have problem with that, because caffeine is a stimulant and it hampers your sleep, and it reduces the sleep quality of sleep. So even smaller quantities of caffeine have a big impact on the toddlers or the children. So what about pets? Again, a lot of people do sleep with pets and they are very attached to them. So it's a big no, because again, a pet movements and noises during the night can awaken your child. So try to have your pet sleep outside your bedroom. Maybe you can make that transition easier when you say a good night to the pet in the bedtime as a routine to the child. So don't allow them in the bed. That should be a problem, especially with the sleep as well as for their allergies too. And make how to make a sleepy bedroom. I mean, that's a lot of people ask, how do I make the child bedroom as comfortable as possible? The first thing starts with the room temperature. So it has to be on the cooler side because the body cools down when you're sleeping. Don't try to make it more cool, but the temperature should be not more than 2 to 3 degrees than the normal outside temperature. And noise, you need to actually cut down all the noise. Some people do have noise cancellation curtains. They have this noise devices where they have a regular noise to cut down the outside regular noise. Then do some people do use a fan also to have a little bit of noise so that they can sleep. That part of a routine. The most important thing is the light level. Again, when you're talking about sleep, if you have in the bright light, that will affect your child. You need to dim the lights when you're planning to go to sleep. Let's say it's at 10 o'clock or 9 o'clock. You need to plan it accordingly from the 1 hour or 2 hours before. Dim up the lights and make your child's bedroom as dark as possible. If he's having problem with a very dark thing, you can make a smaller lights, especially on the red, not blue, but red or yellow patterns. And the other problem with what we actually see in a lot of patients is bedtime worry, and they have all the possible stress. They remember everything in the nighttime, but that's not the right time to discuss all your anxious thoughts or all the worries. So the best thing what we tell them to do is write a journal. They encourage your child to write a diary and everything about their anxious thoughts. Make it in the daytime. If they don't want it in the daytime, maybe in the nighttime. Reinforce them or ask them to write good things what has happened in the daytimes, because the positive things what they focus on will help the child feel more secure. So in that scenarios, your child might be more feel more secure and maybe fall asleep nicely. Another thing what we ask them is mindful exercises. Mindful exercises means a little bit of meditation, might really help them soothe their minds and probably fall asleep nicely. And create a worry time. Like I discussed, discussing worries in the night time before going to sleep is a big no. Again, you need to set aside a specific time during the daytime, during day, where you can discuss with them. Nighttime, you need to do more of a positive things so that your sleep is not disturbed at all. So the art of room checks. A lot of people are, a lot of children are used to sleeping with their parents and everything, and they want their parents to be beside them because they are scared and everything. But you need to tell them, you need to reinforce them, or you need to tell them that you'll be checking them quite often. But you can't go whenever the child is crying or calling for your help. You need to wait for certain time so that usually they awaken and then they fall asleep by themselves itself. So you need to create an environment where they feel stay safe, and they need to understand that they also can sleep alone rather than depend on their parents and their caregivers. So that is also very important. So a lot of people come down, a lot of in fact come down with bedwetting and sleep. So that's also a problem. But again, its medical term is nocturnal enuresis, and before the age of 7 years, it's not at all an issue. And the bedwetting is even very common, and it's generally we say that it's a last stage in potty training exercises. But if it stays back, and if it's bedwetting is persists beyond the age of 7 years, you need to consult a pediatrician. Some simple tips what we can give it to the people or children or parents is to establish a very regular bedtime routine. Walk your child to the night and typically wake up the child before the specific time and ask him to go to the toilet. and develop a reward system to encourage a child, like stickers or for the dry nights. Take care of your child's advantage, like, ask them that you don't have to wear a diaper or anything, and limit beverages and fluids, especially in the later part of the night, even if they ask for. And you should be very patient with them, understand, and be attentive. They can't punish the child because the child wets bed, because that has negative impact. And you don't have to talk about the bedwetting in front of others, especially in front of the child, so that has a negative impact psychologically also. So the tips, what I can generalize is, the first thing is to remove the screens from your bedrooms. That's the first thing. Establish a bedtime routine, and cut down the calories. You need to do exercises, and create a sleep environment, a nice sleep environment with a good temperature, a good mattress. That will go a long way. Get wet. Some people do take a bath. That will have a good effect on the sleep. That what I say. And some people do have a nice a warm milk. That will also affect on the sleep. Keep it very quiet in the bedroom. That will also help you child sleep. Check the size of the mattresses. Check the size of the bedroom, bed sizes. Don't use going to sleep as a punishment. You can't punish a child because he doesn't go to the bed. So again, that will have long-term impact on sleep. And don't encourage them that they should be staying late in the night, late in the morning time as a reward. Again, psychologically, they have a lot of problems. Avoid any bedtime negotiation, like, you need to actually give it to them that what kind of pajama they want to wear, what kind of book they want to read, what kind of story they want. You need to give it to them. And make sleep a priority also for the parents, because they mimic parents. Yeah. Thank you very much.
Thank you,
I
Doctor.
will be happy to take questions.
Thank
Yeah.
you. Thank you,
Yeah,
Dr.
ma'am, I'll speak for a couple of minutes, then we'll go for questions.
Yes. Yes,
Dr.
yes.
Sir, thank you very much,
Dr.
Dr.
Bharma. It has been a very enlightening session.
Yeah.
And
Dr. Sir,
we
please
now request
stop
our
sharing your
chairman
screen.
to take over.
Good evening, everyone. I would like to share my experience with hostel students. What are the challenges we have been facing with hostel students when we were trying to work with them? Morning 5 o'clock to evening, night 9:30. Last year, when we were working with the students to teach meditation in the morning and also practice yoga in the morning and make sure that children run at least 10-15 minutes, and also practice good amount of time in the physical exercises, we were receiving some complaints from teachers saying that some of the children are sleeping in the classrooms. The biggest challenge we have been facing is, other than the children who are sleeping in the classroom, at least there are 10% of students who are day scholars, who are hostelers, who are complaining to teachers that they are not feeling well, they are feeling stomachache, and then they are going to dormitory and sleeping it. When I inquired about it, when I studied this behavior pattern, these hostel students, the major challenges, what we understood from the children are, they were chit-chatting till late night. So till 11 o'clock or 12 o'clock, they were chit-chatting. The reasons for chit-chatting also, they are very clear. We usually used to give milk around night 9 o'clock, and also the most of children used to have snacks around 9 o'clock. Because of this, the children not able to get sound sleep, hence they were chit-chatting till late night 9 o'clock, 11 o'clock or 12 o'clock, because this 3 hours of duration, whatever the food they are taking, either the milk or the snacks, spicy snacks, whatever they're eating, is taking time to digest. Then They're also eating lot of sugary items after 9 o'clock because our hostel dinner time is around 6 o'clock. So 6 to 6:30 they would be used to have a dinner. 6:30 to 9 o'clock they used to have study hour. So this 2.5 hours gap, whatever they ate, almost is digested. So 9 o'clock they used to again have something in their as a food. Hence they were feeling really heavy and they are unable to get the sleep. And other important difficulty what we have understood from children is most of the children used to have lights in their bed lights and other lights on in their rooms. Because of that light penetration, some of the children are not able to get sleep, hence they were chit-chatting with others. After discussing with our directors, Mr. Subramaniam and the principal, other people, then I had taken few decisions and also discussed the children that whatever the milk we are giving at 9 o'clock, we moved back that to 6 o'clock. That means along with the dinner only, we used to serve the dinner. Then after that, we ask all the wardens, take out all the snacks, whatever they have it. They should not eat any snack after 6:30. So because of these two reasons, we could convince all the children to sleep by 9:30. In addition to these two things, what extra we did is every day morning we used to wake up the children by 5 o'clock. 5 to 5:15, all the children used to run minimum 3 kilometers in our ground, so that children are spending at least 15 minutes of time for the physical exercise, extensive muscle exercises, so that they get tired and also night they may get sound sleep. After that, children also trying to play compulsorily evening 5 to 6. Because of these 2-3 extra K, whatever we have given, we have seen great improvement children's sleeping patterns, especially they used to sleep by 9:30. They used to wake up without alarm, without much reminders from warden. They used to wake up at 4:45 and 5 o'clock and come to ground much without any difficulty or without creating any difficulties to the wardens. So something similar to this, maybe every parent can try to do at home. Not giving any food items beyond 6 o'clock or 6:30, so that there should be 3 hours of gap between sleeping time and eating time. The second important thing, after 2 o'clock, if you do not give any caffeine items, whether it is the chocolates or it is milk with boost or any other thing, that would help your child to calm down, because caffeine has the capability to stimulate our brain. Our cognitive activities will improve a lot. Even I try to do this with myself. Whenever I don't take coffee or tea after 2 o'clock, that day I can sleep night 9 o'clock or 9:30 without any difficulty. There would not be any subconscious sleep. I could say there is a deep REM sleep. So 9 o'clock, if I sleep by 9:30, I can go to unconscious sleep. So I recommend all the parents, you also start practicing these habits. Instead of asking children not to eat chocolate or not to eat sugary items of 2 o'clock, you also stop taking tea or coffee beyond 2 o'clock. Because these caffeine items have 8 hours of impact on our brain. If you take 2 o'clock, this caffeine will stimulate your brain till 10 o'clock. So this practice would help you. What to do? Because all of us had a habit of eating or taking snacks, having tea, coffee evening 4 o'clock. Instead of taking caffeine items, you can try to take something like green tea, or where you don't have much stimulation activities towards your brain. The second important thing, what you can try to do to give sound sleep to your children is power down time. Try to teach the children and you try to practice yourself power down time. What is power down time? Before going for the sleep, 1 hour before, try to, if you are making your children to sleep every day at 9:30, by 8:30, try to focus on very less intensive activities. Do not speak loudly. Do not shout at anyone. Don't try to watch screens or TVs or serials or mobiles. Just do very light activities, something like folding the bedsheets or folding the clothes or just reading a nice book or try to just write journal as suggested by Dr. Sandeep, or try to ask the children if they are interested in any stories, or ask them to share their experiences in the school, or ask them to talk about their future. Anything which should be very light so that brain will not be really stimulated. In fact, prior to sleeping of your time, bedtime, you should never try to do any serious thinking or serious discussion, serious questions, because brain gets stimulation and it will not, though you are on the bed, you will not be getting a sound sleep. Rather, you just thinking about those things. Instead of daydreaming, you're doing night dreaming. See, night 10 o'clock to morning 2 o'clock is a crucial time for our body to take rest. It is deep sleep time because morning 6 o'clock to 10 o'clock, we have been doing some physical activity, some exercise to regenerate your body, to give rest to your body, to energize your all other body organs. This is a crucial time. So for that, your brain should not give any extra thought process to move on. Why this is 10 o'clock to 2 o'clock is very much important. Prior to invention of the bulb, that means 150 years back on, right? Prior to invention of the bulb by Thomas Alva Edison, all of us, our ancestors, our human beings, used to sleep by 7 o'clock or 8 o'clock by looking at sunset, and sun was our time clock, right? So as soon as sunset happens, everyone used to think that it's a night, now it's a sleeping time. No other extra work or extra entertainment or extra discussions, extra debates, extra work, night work, those days were not there. Hence, our body, our circadian rhythm habituated to this for thousands of years onwards. It doesn't know light, it doesn't know darkness. It only knows day and night. Sunset, before sunset, after sunrise. Only these things only body knows. And our body itself started working like a bio clock. Our body used to work like a 24 hours bio clock. Now we have alarm watch. Now we have alarm watches. But those days, neither we have alarm watch nor any other reminder. Our body itself used to like a bio clock. Hence, when you sleep by 9 o'clock or 8 o'clock after your dinner, 6 o'clock, so 8 to 9 hours of sleep they used to take. By 6 o'clock, they used to wake up using their bio clock. Hence, so body is habituated thousands of years like this. Now, once you start tweaking it, you will not have efficient work because they would be thriving or seeking for your sleep. Sleep is like a hunger. See, when you don't eat one meal, next meal you eat too much. So these things you should understand. If you don't allow your children to sleep or you don't sleep in a particular day, maybe later point of time, you may need to take this sleep debt from the bank, the way we throw, right? Sleep debt, whatever you lost because of your behavior patterns, because of your diet, all those things. Hence, I always recommend you as a parent and children, start practicing sleep routines. Try to sleep irrespective of your challenges, irrespective of works. Try to sleep every day by 9:30 or 10 o'clock, wake up by 5 or 6 o'clock so that you'll get minimum 8 hours of sound sleep. Hence, your remaining 14 hours or 16 hours can be very effective, highly energetic. You'll be very calm. You can do multiple things without much distraction, right? So I have seen in our hostel students, when I interact with especially grade 9 students and grade 10 students, they used to say that, sir, now since we are really doing physical exercises and trying to walk and trying to play with the barefoot, there is some principle called grounding. When you walk with your barefoot on the gravel or on the grass, there would be some kind of ion exchange reaction to happen between earth and your body, so that you also get little more energy and you will get sound sleep in the night. That is the reason when farmers go home after 6 o'clock, 7 o'clock, they sleep because they walk on the field with the barefoot they do lots of physical exercises. I also observed in hostel students, whoever were playing very heavily evening 5 to 6, especially football or doing any weight lift using basketball, those children used to focus a lot. Those children used to sleep by 9:30 without any difficulty. Hence, I encourage and invite the parents and children, start doing some weightlifting activities evening 5 to 6, do some physical activity, move on the floor at least every day 15-20 minutes with a barefoot or without shoe on the grass or gravel. So that would give you a very good sleep in the night time, because there would be ion exchange would happen between earth and the body. In addition to these three things, before sleeping, you always teach your children how to really say or show gratitude towards the things which happened for a particular day. Whatever Dr. Saab said, you can ask the children to do meditation by observing their breath, or they can start thinking about what really went on well particular day. They can say thanks to their parents for the food they provided, or say thanks to their teachers for the education they got, or they can say thanks to their friends. It's all about gratitude. Exercise will give you a lot of happiness, and children feel happy to be around with everyone. Then that is the time your mind will calm down, because we are all carrying such a big mind, which is like a computer. It almost generates 50,000 thoughts every day. Because of these thoughts, when you stimulate in the night time, whole night will go, you are daydreaming, night dreaming, thinking, revenging, learning, these things. So do not encourage any stimulant activities in the evening time. Gratitude exercises, meditations, just having storytellings or folding the clothes, just maybe taking care of their books, reading some stories are the good habits. So these are all personal learnings. I also observed same thing at my home with my daughter, who is studying grade 5. Also observe this with my children, hostel students. I see great change in the behaviors. Unfortunately, during this because of this pandemic, from March 16th till today, children are not with us. Otherwise, I should have made such a good habits in our children that they do not require any alarm. They don't need any warden to remind. Their habit patterns should have been fixed so that their habits are irreversible. Now they should have stand as role models on either sleeping patterns or behavior patterns or learning schedule, everything. Because just we started these courses from February onwards, 1.5 months, there is a considerable change in the behavior pattern. I felt very much happy how the children were responding in the classroom. And whenever I get time, I have been interacting with children. They are also practicing at home now. They are teaching their parents. So though sleep is very simple activity, it's very much important activity. Let us encourage everyone to have a sound sleep, minimum 8 hours of time. Sleep is not counterproductive. Sleep is not against productivity activity. Sleep is not a time waste activity. Sleep is very much important. Appreciate someone who wanted to sleep. And also the last but not least, if you have got time, you also encourage children to sleep after lunch for at least 25 to 30 minutes. As the parents, if you get any luxury of sleeping after lunch, if you sleep for 25 to 30 minutes, next 4 to 5 hours of evening time would be very effective. You can perform in 3 hours of time, 6 hours of work. So every activity will be done with higher focus, higher accomplishments can be happen if your sleep is very nice. With this, I'll conclude. I hope you learned something out of this experience. Thank you very much. Over to Lalita ma'am.
Thank you so much, Chairman sir. I think it has been a very enlightening session for all of us. And I would now request Subramaniam sir to take over the question answer session, which quite a few, I think, children have some doubts and they've raised questions. So over to you to moderate this, Subri sir.
Sure, ma'am. Thank you very much, both the speakers. I think it was a very good talk. There are plenty of questions that have come from both the parents and students. The first question to Dr. Sandeep, a parent is asking about this question. Our son is 3 years and 7 months old. My question is, should we channelize his sleep? As the current education system expects certain time to match the flow of education instruction and his overall development. Because of that, he also sleeps in daytime also. He sleeps in the nighttime also. As you suggested, regular time. Please reflect on this issue.
Okay, so daytime nappings are okay, but again, what happens is in the toddlers, what I mean to say is preschoolers, they have this afternoon naps. But again, as we grow older from the preschool to schooling, proper children and the school going children, they don't have afternoon naps because they outgrow it. And if you have a child is having at least 10 hours of sleep in the night time, they shouldn't be sleeping in the daytime. If they are sleeping in the daytime, you need to speak to your teacher to your school, whether he's able to concentrate on his activities, how is his cognitive things, how is he able to appreciate anything. So if there is any problem with that, then probably he might be having some kind of a medical problem. So like, going to sleep, but not getting in the deeper part of the sleep. Maybe he's having a simpler problems in tonsils, adenoids, which is having a problem. You need to take care of that. So those are the very simple things, but will have long-term impact on your child's health and also his day-to-day activities.
Okay, thank you very much, Doctor. And one other very important question is, this is coming from a parent. What precautions can we take if we are working in the night shift as part of our regular job?
Well,
Very known
what can I say?
scenario right now.
Yeah. So like I said, everything is same except that you need to take somebody has to take a charge of your child's safety and reinforce that the sleep timings, sleep pattern is maintained. Your guardian, probably the guardian who is taking care of, nothing else changes, absolutely, because the child's health and the child's other things are taken care of by the guardian. So everything remains same. Proper sleep hygiene, proper timings, 10 hours of sleep, a must. So that's about it.
Okay. And one other.
The question is about parent and child.
So, Dr. Sab, the question is, if a person is working during night hours and all that as part of regular job and all that, what kind of precaution that person should take care? Because more likely, that person has to sleep during daytime and all that, right?
Dr. Sab, shall I add to this? Whatever you said?
Yeah, sure, definitely, please.
Yeah. Subhi, maybe to the parents, whoever asked this question, this is very genuine question. After invention of light, all these challenges had come. So what I recommend to the parent, whoever is working night shift and day shift, in fact, he should create his own environment. As soon as his night shift completes, right? For him, the night is a day, and remaining all the day is has to be like a night, right? His room should be like night. Is let him finish his dinner in the morning after completing the work, and let him not interact with others. At least 7 hours of sleep should have in the closed room with dark windows and no noise. And for example, if the parent night shift is completing by 6 o'clock, let him have dinner at 6 o'clock, and 7 o'clock he can go for sleep. 7 to 2 o'clock without any sleep. The closed room it happens. What would happen is, or circadian rhythm will understand that that is how the body is routine, and that's how you can really hack your body that your night is morning 6 o'clock to 2 o'clock. So in fact, I tried this when with some of the people who are working with me in the night shifts when I was working for Disha Software India. So it really worked out well, and they are really fit. In fact, those people used to have lots of sleep difficulties, some like sleep apnea, other things. and after following up this simple hack, they perform really well. Dr. If you want, you can add on top of it.
Yeah, absolutely right, sir. I totally agree with whatever points you have said. Obviously, the timings are basically there is a clock inside everyone. What they say, that's what is circadian rhythm, and that's what it tells us. Whether when is it daytime or nighttime, when should we go to sleep, and that's the reason why without even alarm, people get up in the morning when they really want to. So that's called a circadian rhythm. What goes in. The problem with the night shift workers or night shift in today's scenario is like the whole clock changes, and they need to actually train themselves that to make that on the day is a night. So absolutely agree with the light thing. Light is a major thing, to dim off the lights and everything, noise and everything. But again, what we say when we actually encounter this kind of patients is like, or companies which they come down, so they have the shift systems, like when they are working in the night for a week, then they work in the afternoon and they work in the daytime. So the sleep patterns remain the same. But absolutely agree with whatever points you said.
Yeah, that's difficult. See, once you try to hack your brain to show that your morning 6 to afternoon 2 o'clock night time, let us continue this hack for at least 1 year, not for every 15 days or not for every 1 month, because you are trying to hack your brain, something like a jet lag, right? So you
Absolutely.
need to habituate your body for one body clock, not for routine. Every 15 days, you cannot confuse your mind that now it's night, now it is sleep. So this is not possible. Let us be cautious, and we can negotiate with the company on this. Company would agree 100%. Yeah.
One
Thank you.
last question before Lalita ma'am, I can hand over back to you. This question is from a parent. My son is 9 years old. He has so much problem in breathing. One doctor said that he has asthma problem. So every day we are using inhaled spray. Then only my child is sleeping. How should we avoid this spray? Please tell me a solution, sir.
Well, if the doctor said that your child has an asthma problem, asthma is like a disease which worsens especially in the night times or in the early mornings, where your child's airways becomes narrow and they have wheezing sounds, and sometimes that will hamper the sleep of the child. So the thing is not to the spray is not for the sleep as such, but it is to control your asthma. And if the asthma or the breathing problem is controlled, and if the child is comfortable, obviously he'll fall asleep. So I don't think you should try to avoid the spray, because and asthma sprays are life-saving devices. You need to continue those devices to treat the asthma. I think once the child asthma is under control, that shouldn't be a problem at all. And don't think of avoiding the spray, because again, if the child has an asthma attack, that will be a bigger problem rather than taking a everyday spray.
Okay. Thank you very much, Dr. Sir. And I think there is one other question not related to this topic, Lalita ma'am and to Naidu sir. There is one question from a parent asking about senior secondary, related admission. Would you like to add anything on that?
Yes, Lalita ma'am.
Yes, sir, I will. So parent, we are very happy to announce that, we are starting our senior secondary from the coming academic session. And we have already started making admissions. In fact, there are quite a few people, we have not advertised, but there are quite a few people who have approached us, and we have started the process, and we will be very happy. It will be one of the best in terms of the holistic development of every child, not only in terms of their academics, but also in terms of giving them exposure to different career avenues and what kind of an aptitude the student has, so that they can take, and a lot of internships would also be there. And we would probably request Dr. Sandeep also to give us the opportunity for some students to intern with him. So there are many exciting things. So we are starting the coming academic session. Yes.
Thank you, ma'am. And that would be all from Q&A, ma'am. Back to you. to conclude this session.
Yes. Yes, sir.
Thank you, Dr. Sandeep
So-
and parents. It's a
Thank
really
you. Thank you
great
so much,
session.
sir.
Thank you very much.
Thank you. Thank you, Dr. Sandeep, Chairman, sir, and Subhi, sir. It has been a wonderful session, I should say. And there is a lot of takeaways. Even, in fact, sometimes I can also say that I am not a very good in terms of my sleeping patterns, but there is a lot we need to learn. And one of the best takeaways is not to keep the screens anywhere close to us. And thank you so much for that lovely suggestion. And it has been a very enriching and enlightening session for all of us. And there are many comments in our chat box also, speaking about the usefulness of this session. Thank you, Dr. Bharma, and thank you, Chairman, sir. And we
Thank you all.
conclude it.
Thank you all.
Have a
Thank you,
wonderful
bye-bye.
evening.
Thank you all. Bye-bye.
Have a nice day. Thanks.